Hey there, fellow YouTube enthusiasts. Today, we're diving into a critical and often overlooked topic, the ongoing Ebola outbreak in the Democratic Republic of the Congo, DRC, and the recent developments in the fight against this deadly virus. Now, I know Ebola might not be the most glamorous subject, but trust me, it's crucial to understand the challenges faced by the DRC and the global health community. So, let's get started. First things first, the numbers are staggering. Over 3,300 confirmed cases and 1,487 deaths in the DRC alone is a crisis that demands our attention. What makes this situation even more concerning is the fact that the eastern Ituri Province is the epicenter of the outbreak, accounting for nearly 90% of all confirmed cases. This high concentration of cases in a single region is a recipe for disaster, and it highlights the urgent need for targeted interventions. Now, one of the most exciting developments in the fight against Ebola is the clinical trial launched by the National Institute for Biomedical Research in Ituri. The trial aims to evaluate an investigational antiviral drug for post-exposure prophylaxis among people at high risk of Ebola infection. This is huge, folks. It's like having a secret weapon in the battle against this virus. But here's the catch. There are currently no approved vaccines or specific treatments for the Bundibugyo strain of ebolavirus, which is the strain circulating in the DRC. So, this trial could be a game changer, but it's also a long shot. We'll have to wait and see if the investigational drug lives up to the hype. Speaking of hype, the World Health Organization, WHO, has issued a stark warning about the overall public health risk in the DRC. They're right to be concerned, as the continued transmission along major internal and cross-border mobility corridors poses a high risk of further national and international spread. It's like a ticking time bomb, and we can't afford to ignore it. But here's the thing, despite the absence of new cases in Uganda, they remain at high risk of reintroduction because of the ongoing outbreak in the neighboring DRC. So, even as we celebrate the end of the Ebola outbreak in Uganda, we can't relax our guard. Now, what makes this situation really interesting is the interplay between local and global health systems. The DRC's health authorities are on the front lines, battling the outbreak with limited resources and infrastructure. Meanwhile, the WHO and other international organizations are providing support and guidance, but the challenge of coordinating a global response to a local crisis is a complex one. It's like trying to put out a fire with a bucket of water when you're miles away from the source. In my opinion, the key to success in this battle against Ebola is a multi-pronged approach. We need to invest in local health systems, provide targeted interventions in high-risk areas, and develop effective treatments and vaccines. But we also need to think about the broader implications of this outbreak. It's not just about stopping the spread of Ebola, it's about building resilience and strengthening health systems in the DRC and other vulnerable regions. Because, let's face it, Ebola is a symptom of a deeper problem, the fragility of healthcare systems in many parts of the world. So, what can we do to help? Well, for starters, we can raise awareness about the ongoing outbreak and the challenges faced by the DRC and other affected countries. We can also support organizations working on the ground to provide medical care and support to those affected by the virus. And, of course, we can advocate for increased investment in global health systems and the development of effective treatments and vaccines. Because, in the end, it's not just about stopping Ebola, it's about building a healthier, more resilient world for everyone. Thanks for joining me on this journey through the world of Ebola. I hope you found this video informative and thought-provoking. Don't forget to like, comment, and subscribe for more content like this. And, as always, stay curious, stay informed, and let's work together to build a better world.